But first tonight, our top story at 11.
I really couldn't imagine it happened to our family, especially to our kids.
A Caldwell County family shaken by the reality of their teenage daughter hospitalized with COVID-19 complications. Tonight, this 14-year-old continues to recover after being airlifted to a hospital in Asheville. Her mother telling WCNC Charlotte the virus has taken a tremendous toll on the teen. Tonight, our Brianna Harper shares her story and talks to the experts about how the Delta variant is spreading quickly among our children.
The mom of 14-year-old Zoey Taylor says her daughter was in picture-perfect health. That is, until she got a fever at the start of the month, paired with plenty of other symptoms.
The body aches start coming, and then she couldn't keep any food, and the liquids, like she couldn't keep anything down.
Days later, Zoey tested positive for COVID-19, and things soon became much more serious.
And she says, "No, I can't breathe, Mom." So I took her to the ER again. And then when we went to the ER, they tested her oxygen level, and it was like at a 64.
So dangerously low, she had to be airlifted to Mission Hospital in Asheville and placed on an oxygen machine. Her mother says the reality of it all left her in shock.
She wears her mask everywhere we go. She wears her mask at school. And she doesn't have any, bad health conditions. I mean, she doesn't have asthma. She doesn't take any medicine. She's perfectly healthy. But yeah, something as dangerous as COVID still got to her.
Experts say that's now the case for many children as the Delta variant continues to spread.
We seem to be noticing that children are being more likely to get the Delta variant, but also having more symptoms than previous variants. So I think that's being shown, and there are actually more children in a hospital and in pediatric units than there used to be.
And then there's also concern for how these COVID cases could have lasting impacts, sometimes symptoms lasting up to 8 weeks after the initial infection.
So in long COVID, the most dominant symptom tends to be that deep fatigue and exhaustion.
Doctors encouraging lots of rest and a slow return to normal activities, while Zoey's mother urges COVID caution.
I would definitely still follow the mask mandate rule. I would still wash your hands and be careful, because you may never know.
And the good news is Zoey no longer needs oxygen to breathe, and she was taking off IVs earlier today, but she still has a slow healing process ahead. Now, if you would like to help the Taylor family cover some of these growing hospital bills, just visit our website at WCNC.com, where you'll find a link to this GoFundMe to donate. Brianna Harper, WCNC, Charlotte.